through a whole process here, but you've been nominated for it and have won this month's Daisy Award.
Wow. Extra shot.
So I get the privilege of telling the story of the Daisy Award, and so with that, we're going to kick it off. And it's a quick program, but it's all in honor of you. So, in late 1999, Patrick Barnes awoke with some blood blisters in his mouth. Having survived Hodgkin's disease twice, he was admitted to the hospital and diagnosed with the autoimmune disease ITP. Pat and his wife Tina had just had their first child 2 months before he came sick, and unfortunately, after 8 weeks, he passed away. His father, Mark Barnes, said, "We're so blessed that we were able to spend the 8 weeks of his hospitalization with him and his family. During those 8 weeks, we experienced the best of nursing." As a patient family, they expected Pat would get great clinical care. After all, that was why he was in the hospital. What they didn't expect was the way the nurses delivered that care. The kindness and compassion they gave Pat and all of us in his family every single day. That's the separator. They were awed by the way the nurses touched him, spoke with him, even when he was on a ventilator and totally sedated. I'm sure the nurses were extremely busy, just as you guys are all right now. They kept the family informed and educated and eased their minds. They truly helped them through the darkest hours of their life with soft voices of hope and strong, loving hugs that today they still feel. Just days after he died, they began to talk about what they could do to help fill the giant hole in their hearts. And Tina came up with the acronym DAISY, standing for Diseases Attacking the Immune System. First and foremost, they knew they needed to say thank you for the gifts nurses gave their patients, and they give their patients and family every day, just as they had experienced. As a result, they created the Daisy Award for Extraordinary Nurses and piloted the program at Seattle Cancer Care Alliance, whose nurses cared for Patrick during the last weeks of his life. They could not have anticipated the Daisy Award would become an international award coveted by all nurses. The Daisy Award is a heartfelt appreciation to nurses for the important difference that they make in all of the lives that they touch. Congratulations.
Thank you.
There's more to come.
Okay. So, just have a little bit of a short bio to read about Laura. So Laura is a RN BSN. She graduated from James Madison University's nursing school and began her career in Virginia. She worked for 4 years there before coming to Iowa. She started out in med-surg, progressing to intermediate care and then to the ICU. She started in the MICU here at UIHC in August of this year and has adapted to the unit, the patients, and the people very quickly. She's already proven to be a wonderful teammate and a positive patient advocate in her short time here. Colleagues enjoy working with Laura as she brings a positive spirit to work each shift, and her patients are lucky to have her as she stands out in her care, as shown by this Daisy Award. And the team is so fortunate to have her. We look forward to what the future will bring for Laura, and we want to congratulate her on this Daisy Award.
Yes. Awesome. So I wrote your nomination, and I'm going to read it now. So Laura provided truly excellent care to an extremely difficult patient on the MICU and deserves recognition for how she promoted patient dignity. The patient had a very complicated case, and despite multiple consulting teams, there were a lot of questions about what was going on with this patient. She was extremely agitated and not redirected. When Laura came on shift, the patient was in 5-point restraints due to her agitation and trying to get out of bed, as well as pulling it for medical devices. Laura quickly assessed the patient and recognized that she was in between a rock and a hard place. She spoke with the LIP to determine that if the patient truly needed the tube in her nose to receive oral meds, and together the team decided that since this was agitating the patient, it would be best to convert most of her meds to IV so that Laura could take the tube out for the patient's comfort. This appeared to help some, but the patient was still very agitated. She then considered that despite the clear need for restraints, that maybe they were actually contributing to the patient's agitation instead of helping. She then started to give the patient a chance to get out of restraints. As she removed the restraints, the patient did appear to be less agitated, but still in a way that meant she had to stay in the patient's room constantly, even though the patient also had a one-to-one NA sitter because the patient required so much care. The patient was constantly moving and trying to bite anything she could get her teeth on, but Laura continued to provide dignified care to this patient by giving her a bath, rubbing her back, and washing her hair with a shampoo cap and detangler to try and get her matted hair back to normal. Throughout the day, Laura continued to advocate for this patient, all while maintaining an incredible amount of patience for a very long and trying day. Despite the best efforts of the medical team, the patient yelled all day, and Laura's ability to provide dignified care and to constantly reorient the patient for 12 hours was truly astounding. Thank you, Laura, for your incredible care of this patient. We are so proud to have you on our MICU team.
Congratulations. Thanks. My name is Emily Ward. I'm the Associate Chief Nursing Officer, and myself and our CNE Kim Hunter are going to present some of the awards for you here today, okay? So first of all, you get a Daisy tote bag with all your goodies in it to carry everything home. Second, you get your Daisy, oh my gosh, what is this called? A certificate. My goodness. Apparently I need caffeine. Your certificate, which is signed by the Barnes family, as well as our CNE Kim Hunter. And then I'm sure, yeah, you've got some pins already, right? Daisy team, because you guys are so amazing. But you also get the Daisy winner award pin that you can put on your badge as well, so that everyone will know that you've been one of our Daisy award winners. And then we also have a copy of the nomination in here for you as well. One of, I think, the most special gifts that you get as a part of a Daisy award winner is the Healing Touch soapstone statue. So for those that maybe don't know, Zimbabwe is a really troubled economy, and the Barnes family has partnered with them to create these handmade soapstone statues. So each one is just a little bit different, and there should be a signature along the bottom from the artist. And so, you know, for each one to be individual is really special, and then it's a way for the Barnes family to be able to give back to the Zimbabwe you know, community and economy as well. And there's a link on their website as well if anybody wants to check that out. And then we have your bouquet of daisies that you can take home. And then we also have your Kleenexes here. We'll keep your banner up for the entire month so everyone will be able to see and recognize you. And then we have one more thing.
Oh, yeah. I feel like Vanna. A whole box. All right. So we have a whole box of cinnamon rolls, but there's a story behind why every Daisy recipient gets cinnamon rolls. So when Patrick was sick and in the hospital, one day his dad came to visit him and brought cinnamon roll for his dad's breakfast. And he asked Pat if he wanted some, and he said sure. And then Pat ended up eating the whole thing. So his dad says, gosh, I was really happy that he ate, but I was really disappointed he ate my whole cinnamon roll. Right? And so I think it became kind of a joke for them. And then when his dad and stepmom were leaving for the night, they said, is there anything you want us to bring you tomorrow? And he wanted cinnamon roll, but he said, please be sure to bring enough for all the nursing staff in the unit. And so the Barnes family just says, you know, nursing is such a team sport, and it's really evidenced by your team members you have here. It's all of you working together to take care of all of these patients. And so they want to, the Daisy team wants to recognize you and all of your team members with cinnamon rolls, since those were Patrick's favorite treat. And so what they say to all of us is whenever you are anywhere and you're tasting cinnamon, you're smelling it, you're baking with it, it's just a prompt to say, you know, you are so special, and I just remember that. So in any case, all the cinnamon rolls are individually packaged, and they're in that box right there behind Alex for you to have and to share with your team. We're so proud of you, and we're so happy you joined us at UIUC.
Yeah, thank you.
Yeah, thanks.
And all those pictures, right?
Yes, we have to do pictures to memorialize the moment.
Okay.